In the final part of our project, we will be addressing educational inequality for low-income elementary students. As stated in Part 2 of this project, Title I of the Elementary and Secondary Education Act provides federal funding to schools with high numbers or high percentages of children from low-income families. While the intention is to ensure that low-income students have the opportunities to meet academic standards, a major shortcoming is how schools use these funds. 67% of Title I schools opt for school-wide programs rather than targeted assistance, which can dilute the impact of funding on the students who need it most. I propose reallocating a portion of this funding to create targeted programs for the most disadvantaged students, using the already existing per-pupil expenditure data and needs assessments to guide allocation. This would allow schools to directly address the root causes of underperformance, such as lack of access to technology, food insecurity, or learning disabilities. Virginia, Arkansas, and Colorado are states with comprehensive needs assessments, with Virginia's process pictured here. By targeting funds, interventions can focus on the actual barriers faced by low-income students, whether it's access to learning technology, specialized instruction, mental health support, or family outreach. Funds would be used more efficiently, ensuring that resources are not being spent on programs that are either redundant or disproportionately benefiting students who are already performing at or above grade level. The model avoids a one-size-fits-all approach, promoting equity rather than equality. It may be argued that this recommendation could burden administration in reallocating budget items, but since schools already collect per-pupil expenditure and demographic data, this shift would not require massive changes in data systems, rather in budget allocation decisions. Additionally, there may be a perceived burden on students without the needs accommodated with this recommendation, as they won't be receiving the same supports. However, this plan requires minimal negative externalities, as providing accommodations like additional time or technology access does not negatively affect students who don't need them. Instead, it helps ensure a level playing field. An example of a successful implementation of targeted interventions was at Central Point Elementary School in Oregon, a Title I school with 50% of its students experiencing poverty. Using a targeted intervention called the Orton-Gillingham approach, a multisensory approach to teaching students with dyslexia. Pictured on this slide are the reading levels before and after the program, with a significant increase in students above the average literacy rate in each grade over time. This is just one example of success, but it can be implemented nationwide, with schools tailoring their approaches to the needs of their students once conducting needs assessments. In terms of ethical justification, both contractualism and utilitarianism could be considered. Contractualism holds that an action is morally right if it cannot be reasonably rejected and prioritizes the most burden. From this standpoint, reallocating Title I funds in this way is justifiable because the students most in need of educational support would benefit greatly, and those who do not receive targeted funds aren't harmed or made worse off. Additionally, a student who doesn't receive an accommodation has no reasonable grounds to reject a system that helps others meet the same academic standards, especially if their own learning is unaffected. In fact, not reallocating funds and allowing the most vulnerable to continue underperforming would be unjustifiable, as those students would be disadvantaged by a system that could help them but chooses not to. Furthermore, utilitarianism focuses on maximizing net aggregate good, otherwise known as overall happiness or welfare. Targeted funding would increase the total educational gains across a student body by lifting up the lowest performers and most disadvantaged students, whose potential gains are the greatest. Since this intervention uses existing resources, it avoids the political and logistical hurdles of increasing budgets, therefore offering a high return on investment in terms of educational outcomes. For example, the Education Law Center, a nonprofit dedicated to ensuring high-quality public school education, created a brief for its advocates, stating the importance of targeted resources for low-income students. The figure on the screen is from this brief, showing the overall returns on investing in low-income students outweighs the cost and leads to overall utility.
Educational inequality isn't just about test scores or missing homework. It's about structural injustices, poverty, housing instability, food insecurity, trauma, and even lack of access to healthcare that prevent children from learning. As one researcher said, children cannot learn unless their basic needs are met. Schools alone can't fix these issues. That's just the reality. When children come to school with unaddressed trauma, chronic health conditions, or housing instability, learning takes a backseat, no matter how good the curriculum is. Schools alone can't solve this problem, but there is a model that can help. Full-service community schools, also shortened to FSCS. FSCS is a model where schools partner with community organizations to meet students' full range of needs. FSCS programs transform schools into community hubs. This can include extended learning, on-site healthcare, mental health services, family support, and community engagement activities. FSCSs are built on 4 main pillars: integrated student supports, expanded learning time, family and community engagement, and then collaborative leadership and practices. Every FSCS is locally adapted. It's not a one-size-fits-all fix. It's designed by stakeholders who know the community best. So educators, parents, students, nonprofits, and local governments decide exactly what their specific local FSCS might look like. And it works. Now, while this research might seem all over the place, because there just is limited research currently on FSCS models, the current research is promising. In a 2020 evaluation of New York City's FSCS initiative, researchers found that students in community schools had 15% higher math scores and 10% higher ELA scores than their peers in non-FSCS schools. Chronic absenteeism dropped by 9 whole percentage points. In Cincinnati, schools that implemented the FSCS model saw the achievement gap between low-income and higher-income students shrink significantly. Family engagement also rose dramatically. At one school in Oakland, California, participation in parent-teacher meetings jumped by 40% after the FSCS model was implemented. And then also anecdotally, families reported reduced stress levels due to access to on-site medical care and food pantries, freeing them to support their children's learning at home. So while there is limited research, the current research is promising for these models. Okay, but why should we care to implement this program? Well, from a utilitarianism lens, FSCS programs maximize well-being and reduce suffering in students. They produce better long-term outcomes, not just for students, but for families and communities as well. And while the programs do have upfront costs, they reduce the need for far more expensive interventions later, like remedial education, mental health hospitalization, and criminal justice involvement. Better attendance, stronger academic outcomes, and healthier, more stable families means fewer of these costly interventions later. Ones like special education, ER visits, and even, like we talked about, juvenile justice system involvement. Every dollar invested in these programs saves multiple dollars later in public services. And also, from a contractualist lens, we can ask, could a reasonable person reject a policy that denies children the basic resources and rights they need to learn, simply because they were born into poverty, which is not something that they can change or something that they can choose? The answer to me seems no. We owe each child the conditions necessary for fair participation in education. FSCS doesn't give some kids more. It gives every kid a fair chance. Now, some people, rightfully so, say that FSCS programs are too expensive or burdensome for schools, and this is a fair objection. But here's the truth. First, schools aren't expected to fund all services. These programs draw from already existing local and federal partnerships, already existing nonprofit investments in the community, and volunteer engagement. They don't create new programs or systems. They use what the local community already has. They just create partnerships. Second, FSCSs don't ask teachers to do more. They bring in trained professionals, like social workers, to handle these non-educational challenges. Third, some do worry that this favors certain students, but FSCS isn't about favoritism. It's about equity. It levels the playing field so all students can access the same opportunities to learn. It's about giving all students, low-income and high-income students, what they need to learn. These are policies that no reasonable person could reject, and denying children support because of their income is indefensible. For our project, we recommend launching a statewide full-service community schools pilot program, strategically placed in low-income districts where the need is greatest. We understand that there is not an insane amount of research on FSCSs, which is why we are not implementing this federally. However, the current research is promising and shows that FSCSs might be a viable answer to educational inequality. Thus, we would have a dedicated design team with deep expertise in education and community development who would oversee implementation and work alongside experienced researchers to evaluate impact using clear metrics like student academic performance, attendance and chronic absenteeism, family engagement and access to services, long-term cost effectiveness, and community outcomes. From the very beginning, stakeholders in the community, like parents, students, educators, and community organizations, must be active partners in shaping and guiding the work. This is for their children, their students, the people who are going to be leading their community later on. And they care about their community and they know their community best, so they must be involved in it from the very beginning. If we truly value fairness, dignity, and opportunity, then we must create systems that reflect and uphold these values. This pilot program is our opportunity to do just that, to test, measure, and hopefully show that educational equity is not just an ideal, but an achievable reality. A full-service community school isn't just a place where students go to learn. It becomes the heartbeat of the neighborhood, a space where children are nourished, supported, and given the chance to thrive as learners and as kids. That's the future we should be building, and we hope to do that with our two project solutions. Thank you so much.